Muscles of the medial compartment of the thigh. These muscles are pectineus, adductor longus, gracilis, and in order to view the rest of the muscles, we have to remove adductor longus. Deep to adductor longus, we have adductor brevis, and if we remove adductor brevis, we see the adductor magnus. The muscles of the medial compartment are called adductor muscles. They adduct the thigh at the hip joint. They originate from pubis bone, and they are inserted here into the back of femur, mostly into the linea aspera. So they adduct the thigh, and also they assist in the rotation of the thigh at the hip joint. They are supplied by obturator nerve. The obturator nerve is a branch from lumbar plexus. It passes here on the medial aspect of psoas major muscle, and it enters the medial compartment of the thigh by passing here through the obturator canal. The obturator foramen in living subjects is closed by a membrane, but this superior part is deficient, forming the obturator canal. When the obturator nerve enters the medial compartment of the thigh, it divides into two divisions in relation to adductor brevis muscle. So if we remove the rest of the muscles, you can see here that the obturator nerve divides into anterior division, anterior to adductor brevis, and posterior division, posterior to adductor brevis. The obturator nerve supplies most of the muscles in the medial compartment of the thigh. So the course of obturator nerve, it enters the medial compartment of the thigh by passing through obturator canal, and then it divides into two divisions related to adductor brevis muscle. The first muscle in the medial compartment is gracilis. Gracilis باللاتيني يعني الحنونة والعطوفة. It takes origin from the body of pubis, the inferior ramus, and a little bit from the ischial ramus. It's inserted here into the upper medial surface of tibia, the SGS area. Here is the attachment into SGS area. So this muscle adducts the thigh at the hip joint, and it also flexes the knee. كل المسلز اللي they are attached to SGS area flex the knee. The surface anatomy of gracilis, it flexes the knee when the hip is adducted. ليش سموها gracilis؟ سموها gracilis لأنها it forms with the shaft of femur this V-shaped space where you can find the rest of the adductor groove. وكأنها حاوطت على الadductor muscles. هلا الadductor muscles here in this space are arranged into three layers. The deepest layer is the adductor magnus. Then over the adductor magnus we have adductor brevis, and on the top the most superficial muscles are the adductor longus and pectineus muscle. So they are arranged into three layers. لاحظ إنه البكتينيوس والadductor longus they lie on the same layer. They are superficial in location. Pectineus muscle. Pectineus takes origin from the pectineal line of pubis, and it's inserted into the pectineal line of femur. It's like the easiest muscle to learn ever. يعني بتطلع من pectineal line and it's inserted into pectineal line. This muscle البعض بيعتبرها تتبع للانتيريور compartment of the thigh والبعض بيعتبرها بتتبع للميديال compartment of the thigh. In fact, it's supplied by femoral nerve, the nerve of the anterior compartment, لكن الأكشن تبعها it adducts the thigh at the hip joint. عموما برضو هاي المسل roughly it crosses anterior to the hip joint, so it assists in the flexion of the hip joint. إذن هاي المسل is supplied by femoral nerve, not the obturator nerve. Next muscle is adductor longus. Adductor longus takes origin from the anterior surface of the body of pubis, just below the pubic tubercle, and it's inserted into the linea aspera, here the middle half of linea aspera, supplied by obturator nerve, and the action is adduction of the thigh at the hip joint. طبعا this muscle is important clinically. It helps to localize the pubic tubercle. So you ask the patient to sit in sartorius position, abduction of the hip with lateral rotation. Then you feel the muscle. You ask the patient to adduct the hip to make sure that you are holding the correct tendon. And then you trace the tendon upward until you reach its attachment to bone. Just above its attachment to bone, you localize the pubic tubercle. Next muscle is adductor brevis. It takes origin from the body and the inferior ramus of pubis. It's inserted again into linea aspera, upper half of linea aspera. Akid, it's supplied by obturator nerve, especially in it runs anterior. The two divisions of the obturator nerve run anterior and posterior to this muscle. Adductor magnus. It's the largest adductor muscle and it's the deepest one. It has two parts. This wide part is called adductor part. It belongs to the adductor group. It originates from the ischio-pubic ramus and it's inserted into the linea aspera. لاحظ بيشبه هذا الجزء بيشبه المروحة. It has narrow origin and it has wide insertion. This part is supplied by obturator nerve and the action is adduction of the thigh at the hip joint. ممكن نسمي هذا البارت also pubic part because it originates from pubis bone. The other part is this one, the smaller one. قبل ما نحكي عنه we have to talk a little about the posterior compartment of the thigh. Posterior compartment of the thigh, muscles here are called hamstring muscles and they originate from ischial tuberosity. The action of these muscles is extension of the thigh at the hip joint. This part of adductor magnus takes origin from ischial tuberosity and it's inserted here into the adductor tubercle at the lower end of the medial supracondylar ridge. وهذا البارت it crosses posterior to the hip joint. Again, it extends the hip and it belongs to the posterior compartment. That's why it's called ischial part or the hamstring part of adductor magnus muscle. حتى nerve supply here, it's supplied by sciatic nerve. As you can see here, between the two parts, the adductor part and the hamstring part, we have this opening inside the adductor muscle. This is called adductor hiatus. Well, adductor hiatus is very important landmark. The external iliac artery enters the thigh behind the inguinal ligament to become femoral artery. The femoral artery is the main arterial supply for the thigh and it descends here to enter the adductor hiatus. When it enters the adductor hiatus, it becomes popliteal artery. وكأنه انتقل من anterior compartment to this area located posterior to the knee joint, the popliteal fossa, so we call it now popliteal artery. Same concept for the popliteal vein. Once it passes through the adductor hiatus, it becomes femoral vein, and the femoral vein here passes below the inguinal ligament to continue as external iliac vein. The femoral artery is the main arterial supply for the thigh. It gives this important branch, profunda femoris artery. The profunda is important. It gives these small branches that perforate the adductor magnus muscle to enter the posterior compartment of the thigh. So the posterior compartment of the thigh is supplied by branches from profunda femoris artery. So these openings inside the adductor magnus muscle are for the perforating branches. Spotting of muscles in medial compartment of the thigh, pectineus, adductor longus, and most medial, gracilis. To view the rest of the muscles, we remove pectineus and adductor longus, adductor brevis, below or posterior or deep to adductor brevis, adductor magnus. All of these muscles are supplied by obturator nerve, except pectineus by femoral nerve and the hamstring part of adductor magnus by sciatic nerve. Surface anatomy of adductor group, and this is the action adduction of the thigh at the hip joint.